Marie Curie estimates that 1 in 4 people who could benefit from specialist palliative end-of-life care do not receive it. Now, you are more likely to get good palliative care, frankly, if you are richer, if you are more educated, if you are white, and if you are younger. These inequalities across our society in terms of access to palliative care are growing, and the demand is growing too. And it is because of these inequalities that I really struggled. It's one of many reasons, and I had a number of conversations with the Honourable Member for Batley and Spen, why I could not support her bill at second reading. And these inequalities really, really concern me. And when you look at the fact that back in 2011, so getting on for 14 years ago, NICE recommendations that there should be a designated palliative care advice line out of hours implemented in every area of the country, but only 1 in 3 areas of the country offer that. That shows you just how poor we are at putting in place what we've already been told needs to be provided so that people can die a good death. If that happened in any other area of care, particularly in cancer, they would rightly, absolutely rightly, be outraged that we weren't implementing those NICE recommendations. The 2024 Marie Curie Better End of Life report said that large numbers of people were struggling to access services. There was late recognition of their needs and poor communication. It found the impact on carers of the poor end-of-life care was also profound. The physical and the emotional toll that it took on carers left one carer saying, the overall experience is that no one really cares. Madam Deputy Speaker, when we are at our most vulnerable at end of life and our loved ones are also struggling, we deserve so much better. And so we need far greater investment in palliative care and in hospice care. And I urge the Minister to take genuine action to address both the geographic disparities but also the deep inequalities that exist in terms of accessing palliative care. And I urge him to do this regardless of whether the bill on assisted dying makes progress or not. But particularly so if it does, because we have a moral imperative. We cannot be, and this is the thing that really grated with me most and why I could not walk through that eye lobby that day, we cannot be in a position that an assisted death is available universally on the NHS to those identified in the bill, but access to good palliative care is not. So I urge him to make commitments, and I urge the Bill Committee to make sure that there are duties written into law to ensure that there is genuine choice at the end of life. And whether that bill passes or not, we need to see much greater action on good palliative care. Thank you.